Hello, all members of the HealthGov organization. Today we are discussing the functions and the advantages of our new AHR system, NextGen, and the new pathways for patient engagement that come along with it. Our goal with the new upgrade to NextGen is that we will be able to provide a more complex patient care to our patients with better health management. We will be able to track the amount of time spent in the room with patients. We will be able to ask and complete smoking sensations in the room while the MAs are rooming the patients. We will be able to have the MAs reconcile the medications and allergies while rooming the patients, as well as update any medical history, any recent hospital visits, review surgical and social history, and review any healthcare maintenance that needs to be done and order those labs or those maintenances at that time. All labs that are done will be able to be resulted in the chart before the provider enters the room. The new EHR system will help us more than just with patient care when the patient is in the clinic. We will be able to track phone calls when the patient calls and leaves messages for the provider's team. We will be able to track contacting patients about their lab results if they have received those results or if they have not. If we left voicemails with the patients. If we have left voicemails with interpreters and what their interpreter ID numbers are for better continuity of care. We will be able to manage tasks from providers or other members of the healthcare team or organization. We will be able to manage appointments and track chronic conditions, making sure that those patients are getting their 3-month follow-ups for diabetes, hypertension, and the labs that come along with that. We will have the ability to refill patients' medications and assure patient compliance with medications, that they are getting the medications refilled when they need to be, letting us know that they are taking those medications. Our new system will allow us to make contact with patients through patient portal also. Our version will be called MyChart. This will allow us to have more frequent communication with the patients, and the patients have easier access to the healthcare team, resulting in an overall win for both sides. This will be available by any web pages as well as by any app on both iPhone and Android if you download those apps. We will have handouts in the office to give to patients explaining directions on how to download the apps, and we will have a front desk associate that will be able to help download those apps at that time as well as setting up the usernames and passwords for patients so that they can log on to their MyChart. Patients will be able to access their vitals through the MyChart. They will be able to access their lab reports once signed by the providers and communicate questions or requests to the care team. We will be able to provide social media accounts that will be managed by HR, Facebook, and Twitter, although these accounts will be not accessible for patient-specific information such as labs that a patient had done or such due to HIPAA violation. These social media accounts will allow patients to be more informed and more involved on what's going on with the organization. Any closures, events that are being held by the clinics, such as fundraisers, immunization clinics, insurance enrollments, and assistance and updates from healthcare departments, such as influenza outbreaks. I look forward to your guys' compliance with this new NextGen upgrade. And if you have any further questions, go ahead and reach out to your direct managers. Thank you.